Good morning. So I'm going to be talking to you about SMA. It's kind of a little bit close to me. I've had some experience with it with one of my old patients. SMA is basically destruction of the motor neurons. It's passed from parent to child. There are 4 different types of SMA. There's type 1, 2, 3, and 4. There are also a couple of subtypes off of that, which are very, very rare. Type 1 is typically seen in infants to 6-month-olds. It's the most prevalent, the most severe, and the most life-threatening. Most of these patients end up on life support, and they usually pass very early on in life, typically by age 4. Type 2 is your children between the ages of 6 months and 2 years. They usually just have delays in their motor development, end up in a wheelchair typically. SMA type 3 is 18 months to 3 years. They typically as well do okay. Motor neuron issues don't usually require life support measures. And the last type is late onset. It's adults. 18 to 35 is when the signs and symptoms start presenting themselves, and they usually just have maybe some muscle weakness, difficulty walking, things like that, and they'll end up in a wheelchair. The overall signs and symptoms are muscle wasting, extreme weakness. Some types have respiratory concerns with them, as well as a lot of them have issues with swallowing. That's a big one. It causes a lot of respiratory infections, so that's why that's really important. There's really only one test that is definitive. That's genetic chromosomal testing. There are treatments. However, one of them is very new. It's a new thing. It's called Spinraza. It's a spinal tap gene therapy. So that's been a new development since I last dealt with SMA. Also, again, people end up on life support, breathing support, respiratory care, different types of treatments to help prevent respiratory infections. A lot of times these patients will also have gastrostomy tubes or NG tubes to help prevent aspiration while swallowing and doing things like that. They as well require a lot of physical therapy, occupational therapy to help maintain those motor neurons and the muscle memory, things like that. SMA is also the #1 genetic cause of death in children, which is really sad. It's a really sad disease if you've ever seen it. All right, well, I hope you're educated. Thank you.